Hey everybody, it's Ryan Steller. This is The Briefing. Somewhere yesterday, somebody was in pain. They got a prescription from their doctor. They walked down to Walgreens to get it filled, and it didn't happen. This has been the story for tens of millions of Americans over the past 3 weeks. This is the third week we'll be reporting on this ransomware attack on the United States' largest, most consolidated and concentrated insurance / healthcare provider organization. That is, of course, UnitedHealth and their subsidiaries Optum, which employs 1 in 10 doctors in the United States, and then Change Healthcare, which is their technology infrastructure company that powers thousands and thousands of pharmacies, claims processing, and payment solutions all over the country. Just to recap, if this is the first time you're hearing the story, United, which owns Change and Optum, and 2,675 other subsidiaries and LLCs, had a ransomware attack that affects as many as 1 in 3 Americans, so as many as 115 million Americans potentially. What happened? A known cyber criminal encrypted 6 terabytes of patient records for a $22 million ransom. Purportedly, that ransom was paid according to transactions viewable on the Bitcoin blockchain. However, UnitedHealthcare has not admitted paying that ransom, nor do they seem to have their systems resolved in a way that suggests that they got the private keys back to unlock their data. Why was this done? Presumably, it was just ransom fees. However, it may be a possible retaliation for U.S. government threats against this group. Previously, they had been attacking less severe, less critical organizations, and this is possibly an escalation after receiving threats from the CISA. It's also been said in some of the filings that this is a nation-state actor, which implies it's potentially an act of war from the origin country, an act of terrorism. Those two claims are not clearly substantiated in the evidence that's been available that we presented in the last couple episodes, but it's still a possibility. When did it start? It started February 20th. By the 21st, United had an SEC filing that is a formal filing through the federal government SEC filing mechanism to tell Wall Street what they thought the impact would be on the stock price. At that time, they said they didn't think there would be an impact on the stock price. Some notes that we have from JP Morgan's leading analyst in the space suggest that there are concerns about that. So we're going to share that in a moment. News this week. So something we didn't report on, February 27th, the Department of Justice started conducting an antitrust probe into United Health Group. It's unclear how much this was going on before, because certainly the 90,000 physicians that Optum employs has been a concern for many Americans for a while now. But I'm sure the cyber attack didn't help, because it creates a too big to fail kind of massive risk. Last Sunday, Corvallis Clinic up in Oregon accused United Healthcare of exploiting the emergency that they created. Corvallis was in negotiation to be purchased by Optum. They were tight on cash flow. The ransomware meant they couldn't get paid, so they were insolvent. They ran the business without paying salaries to the doctors so that they could cover staff salaries for over a week. And it seemed as though, even though United and Change had been the ones that failed in being vulnerable to a ransomware attack, they were somehow going to profit, at least in the eyes of the Corvallis Clinic. Yesterday, the Biden administration, through the Department of Health and Human Services, stated they would start a formal investigation for Change Healthcare cyber attack. This is all 3 parts of the HIPAA statute around privacy, security, and data breach. And it doesn't go into very much detail. And then tomorrow, the timeline suggests that claims processing services should be back up so that small practices, meaning non-hospital, so your Main Street practices, should be able to get access to care again. Before we move on, just want to introduce Mike Martinelli. Mike, how you doing?
Great. How you doing, Ryan?
I'm fantastic. It's warming up here, and the weather's getting nicer. How about out Philly way?
Yeah, same here. Today was a really hot day, but that also means ragweed season, brutal allergies to that. So You know, got a few weeks of that before it subsides.
I think the Mid-Atlantic is worse than we have it, but I'm suffering a bit also. Well, thanks for being here. As always, Mike has done a lot of the background research here, so I want to thank him in advance for that. So what has the impact been? If you're an American, access to healthcare has probably never been difficult in your lifetime. We went through the mid-20th century industrialization or corporatization of healthcare. So it went from, your local Main Street doctor who would do a house visits to hospitals, and then the hospitals started treating doctors more like contractors and interchangeable employees, and we're at the peak of that era. And there's a lot of criticism about that. It also leads to heavy financialization of the cash flows that are going through a hospital, meaning you can do things like write debt against it to do leverage buyouts for private equity, which is a lot of what's happening here. It's left many community hospitals and many providers in a precarious situation where cash flow is very tight and they're very leveraged. So if they miss a couple of payments, even just a week or two, the entire thing can fall apart and the hospital can go out of business or the practice can go out of business. Something like 1 in 3 hospitals are 2 weeks worth of payroll away or of revenue away from completely going out of business. And this is most notably in low resource areas, rural hospitals, inner city hospitals, but it's a remarkably high percentage of all hospitals that are out there. And these are obviously the resources that people care about to get access to care. At the same time, we've never been spending more on healthcare, so you would expect access to be incredible. You'd expect it to be everywhere, more convenient than McDonald's, higher quality than BMW or whatever your high quality brand is, and ideally, very affordable, right? For all the money we've spent in healthcare, it should be more scalable and higher performance on a per dollar basis, on a value basis than it's ever been. The contrary is actually true. We're spending way more than we've ever spent, upwards of $4.5 trillion, which is, as I reiterate over and over again, 20% of the U.S. economy. And as much as 40 to 45% of that, or $1.8 trillion, is considered to be waste in administration, duplicate care, unnecessary care, duplicate diagnostics, billing, and fraud. There's a lot of concerns from everybody. This is kind of a secret tax on all Americans. And we are in a position of looking to regulators to help us fix it because the regulatory environment that exists allowed it to come about, and we need the government to step in to fix it. So patients, if you've had trouble getting access to care, this is a period where the centralization could be felt, even more so than just the rising costs. And the DOJ is stepping in to possibly look at how antitrust plays a role there. Doctors in hospitals, we already shared the story about Corvallis Clinic, how this emergency possibly puts them in a place where they're being forced to be purchased by United, which was a deal that they had many stipulations on, and the stipulations weren't met. But because they're tight on cash, they may have to go through without holding out for the stipulations. And the stipulations were things like after the acquisition, all insurances have to be accepted. After the acquisition, all current care services have to still be provided. So if this acquisition happens under duress, it's possible that this community in Oregon will both lose services and be forced to switch over to United Insurance in order to continue to access care at the same facility or with the same doctor that they did before the acquisition. We're not going to play any of the videos from TikTok, but there are people sharing interesting stories from all different perspectives. Obviously, physicians, some people working in billing, and then some people dealing with lack of access to medication. And in the interim, Health and Human Services, particularly for the federally funded insurance programs, have offered support mechanisms, but they've been widely criticized as not being adequate. Most of the money has been towards hospitals, and hospitals have larger bank accounts, so they have more support to weather the storm. And one of the things we want to incorporate was some of the comments that are coming from Wall Street, basically. UnitedHealthcare has been a great buy since Obamacare, since 2010, and it's had tremendous returns. So there's a lot of analyst coverage, specifically at JP Morgan. There's a managing director named Gillis, and she has been questioning all the other contemporaries in the space, both people who are competitors of United and then people who are customers of United, about what this is likely to impact. And the interesting thing is most people don't think it's a very big impact, which is good. And that kind of makes sense because the billing, even though it can't go through now, it doesn't mean it can't happen. And in fact, these systems used to be on paper. Previously, they're on paper, and still many of them look like they're basically on paper. So the fallback to paper is still a possibility. And even the backlog that's mounting up on physicians' desks can be processed as soon as the systems are back up. So companies like McKesson, CVS, Evernorth, GoodRx, all of these are affected either upstream or downstream in some way, and they have disrupted operations. Some of them are communicating that they will realize less revenue this year, and then that revenue will have a delay and then get pushed into next year. I think that was CVS specifically. Or I'm sorry, maybe it was McKesson. Well, don't quote me directly on that. But there are two memos out from JP Morgan talking about this that you can go check out. That's kind of the recap for now. One of the things that's conspicuously missing is we do not have very affirmative commentary from UnitedHealth on what has happened. They have talked about working with their contractors. So there's a cybersecurity arm of Google called Mendiate, and then Palo Alto Networks, which is their infrastructure provider. So clearly those folks are working as hard as they can, but what I think myself and perhaps the federal government and a lot of observers are looking for is more affirmative communication from UnitedHealth. And in fact, the chief medical information officer of Geisinger had a piece in Stat News this week calling for an updated regulatory framework that borrows some things from the financial industry. And one of the key elements of that I think we've commented in the past couple of episodes is the idea of a postmortem or some sort of expository piece that talks about exactly what had happened, when it happened, with as much detail as possible, getting down to the IP address level, the individual computer level, the individual version of software that was breached, the date, the time, the first point of entry, all the points of entry that were hit, every fingerprint from the ransomware that can be talked about, every communication that may have happened that might have been a warning prior to this that wasn't heeded or was intentionally ignored, all these sorts of things. Additionally, it calls for things like pen testing. Pen testing is penetration testing, kind of like how we do for banks now. Post the great financial crisis, we do a stress test that is a real-world simulation of the bad thing we don't want to have happen. Pen testing and other types of penetration testing and other types of real-world simulations or red teaming, orchestrated and required by the government, not just voluntarily done for your own practices or not just done as part of general guidance from the federal government, but something that is an actual compulsory standard to live up to and pass on a quarterly basis or annual basis, or ideally random basis, actually. That's an active dialogue amongst the leaders in this space. More regulation in healthcare sounds a little scary because it seems like another thing that can be gamed to reduce competition. But in this case, the real world evidence of pen testing and the results of that event, post-mortem communication and documentation of what happened will be critical for preventing it everywhere and learning from this. So, Mike, any thoughts?
To circle back to what I spoke about when we wrapped up our last recording last Thursday, I mentioned that, we're not really going to know for a while going forward until this story continues to unfold, what the enforcement actions are going to be, which agencies are going to be pursuing enforcement. That's actually starting now, even though we're just in the very beginning. We're not even at the penalty phase yet. But I was kind of surprised in a good way, impressed they were able to move so fast. We have multiple agencies spearheading this. Like the DOJ is, I don't think it's just a coincidence of timing that they announced an antitrust investigation into United Healthcare. So they're taking that angle, DOJ, and then HHS is also doing an investigation. I want to emphasize this. OCR is as well, but this is like an HHS all hands on deck, full agency approach to, it's not just enforcement, but mitigation. OCR, I mean, if OCR was to do this on their own, they would need to use every single regional office in the country, which doesn't have that many investigators, and that still wouldn't be enough. So it's interesting how, we know this is a huge breach. HHS, which is, I think, the largest department in the federal government, is using multiple sub-agencies for an all-hands approach to this situation.
Yeah. Are you familiar with any similar like ransomware events that HHS has like precedent over?
I do know of, this is from when I worked there, confidential. I can't say who it was, but it was a high-tech violent where, high tech was what they used for, enforcement mechanism, but it was, I forget whether it was a breach, but it was due to the fact that this healthcare entity, this health system, did not, implement the standards, the minimum standards that are set forth in the HIPAA security rule. So those usually end up in a major fine, or if it's a first offense, there's some kind of mitigation. There's a lot of negotiating that goes on before a final CMP, which is a civil monetary penalty, is levied on a healthcare organization for a security breach.
Okay. Yeah, the other one that comes to mind is AmerisourceBergen, which is another absolutely gigantic company based out of the Philadelphia area, is in the pharmaceutical distribution space. So they, forget their exact revenue, I think it's about $250 billion of revenue. They have very tight margins. They also had a major cyber incident a couple months back. However, I think they hold primarily financial and pricing and inventory information about drugs and less protected health information. It was a lower profile thing. They do have an announcement on their corporate website. They've since rebranded to Cencora, I believe it is. Yeah, Cencora, creating healthier futures. So I should do the research. Maybe I'll include it in the future episode, whether or not it was the same group, because that would be consistent with the escalation and promise by the ransomware group to go after critical infrastructure after the federal government had kind of waved them off more trivial commercial companies in the United States. Any closing thoughts, Mike?
No, I think I covered it all, or at least what came to mind.
Right on. All right, please like and subscribe. If you've seen this, please share it with somebody who's in healthcare, technology, or possibly the government. We are always excited to hear from you, so leave a comment below or email us at hello@standardcare.us with feedback and ideas for future shows. We hope you have an absolutely incredible week.